Good afternoon, everyone. Hope you had a good lunch. Thank you for joining us. My name is Dana Thompson. I'm a project officer for Pennsylvania Developmental Disabilities Council, and I would like to welcome you to this afternoon's Pennsylvania Community Alliance Summit. Our speaker for today will be Monica Ruiz with Casa San Jose. Monica is going to be speaking a little bit more on what she, just going further into details on what she spoke about before lunch and answering your questions. Thanks, Monica.
Thanks. Thank you very much. So I saw that after we finished, there was a question that asks what other counties we're in. And so we're currently working in Lawrence County, Beaver, Butler, Washington, and Westmoreland County, in addition to Allegheny County. So I didn't see any other questions, but I'm happy to answer more questions. And I'm also happy to kind of go a little deeper on any specific program that anybody had a question of, or I can just continue talking. Okay. I will just talk a little bit more about the efforts. I'll talk a little bit about the vaccine efforts that we're currently working on. And so, like I said earlier, if we are lacking resources in Allegheny County and the city of Pittsburgh, where we are a whopping 2% of the population, then just imagine how difficult it is to reach folks in different areas. And so one of the things that we've done is we've partnered with some healthcare providers, and we've been able to take mobile clinics out to areas, even farms, where we've been able to get people vaccinated on the farms. And so if you think about literally our fruits and vegetables that are sitting on our plates every day, like these are the people that are handling those things, and these are absolutely the folks that should have access to the vaccine if they care to. And then also really trying to educate, not only, I always pick on Philly, even though I love Philadelphia, but there are so many Latinos there. And so people don't quite understand that, we are actually about a 5-hour drive from Philadelphia, and it's very, very different, what's going on in this area. And so, organizations and foundations that are based in Philly have a different idea as to what is going on in Pittsburgh. And sometimes even like state officials have a different idea. And so we really try to do our best to make sure that we're educating folks so that they understand that, you would think that Pittsburgh is diverse, because it is, but depending on where you're at, it could be a lot more or a lot less diverse, and a lot less resources, available to people. What else? I feel like I said everything in the other one. Let me think of what else I can cover. We've really been trying to work hard with our youth. And so one of the things, when Casa first opened, our very first program was a youth program. And that program was specifically created because a lot of the kids that we were servicing, were not speaking Spanish at home. They were a lot of times the only Latino in the entire school. They were embarrassed, to talk about where they came from or where their parents came from. And so we wanted to create something that really celebrated culture, and not only the home culture, from different countries, but also here, the American culture. And that has been one of our most rapid growing programs. And it's been really great because every year, we ask the parents what, because the parents are highly involved as well, and what are some of the things that they've seen. And it's always like out of the top 3, that the child is either speaking more Spanish at home or, engaging more in Spanish speaking conversations. So again, that program is for anyone really, but it's really great because kids get to see kids that kind of look like them that sometimes are living very similar experiences to them. Okay, so I have a question here asking me if I'm finding that people are getting vaccinated more and more, or vaccines seem to slow down. So kind of contrary to like what's going on in the rest of the country, because there was no information for so long, vaccine rates were very, very low. Um, since we started, we've gotten at least 3,000 people vaccinated, which may not seem like a lot, but it is a lot for us. Like we're a resource center, we're really social servicey. We're not a healthcare clinic. And we've done this by holding large scale events. And then, like I said, now we have this clinic at Casa on Tuesdays where folks can get vaccinated. And so like the first clinic that we had, we were like literally dragging people off the street to come in and get the vaccine. And we only had 3 people that first day. And then I believe last Tuesday we had like over 60 people. So now that people know that it's there, we've been able to give people a lot of really good information. It's very convenient, to walk in somewhere where people look like you, they speak the language, and it's a lot of times just like hand holding, right? You know, people are hesitant, like, just don't forget, the United States has been pretty terrible, especially to people of color and Latinos. And a year ago, they were performing hysterectomies without people's permission in an ICE detention facility, right? And they've done terrible things in Guatemala and Puerto Rico and California, like, and this is recent stuff that they've done to communities of color. And so people are very hesitant. But what one thing that we are is very family oriented, and especially have if you have different generations of people living under the same roof, that's where, we're able to kind of help people, because the last thing you want to do is get your parent or grandparent sick and give them something that could potentially kill them. What else? Um, I could talk about the growing pains right now. And so we have been really fortunate that we've been able to hire during COVID. And so now we're a staff of 19 and we don't fit anymore at the office. And I mean, that's part of the reason why we do half and half, but also because we want to be safe. The other day, we actually had a larger scale event at Casa, and so we ended up having to put like tents outside, and people had like their workstations out there. And so we're looking at moving to a larger facility. And right now, we have like 3 storefronts, and so there isn't like a large space for people to gather. It's very transactional. People come in if they need something and then leave once they're done. And Casa San Jose is the home of Saint Joseph. And if you think of a home, when people come to visit, they're not just coming and leaving. I'd love to have a place where people can, I don't know, maybe drink some tea or some coffee or have conversations, provide programming uh, at our site. So not only for youth, but also for adults, so people can meet and just be with one another. And, we can really start to figure out how we can make programs better suitable for our community. And then also having a space where kids from all different backgrounds can come in and share space with one another and learn and grow from one another too. Um, are there things people could do to work with you? Sure. You don't have to be bilingual to volunteer or talk to somebody at Casa. We have about 100 volunteers, active volunteers per month that range from, volunteering 15 minutes to volunteering like hours a day to do things. So if you go to our website, which is, I'm going to put it in the chat, and then you can, the best thing I would recommend people to do is to sign up to get our newsletter so that you get a really good understanding of some of the things that are available to you. And then absolutely, contact Sister Valerie there so that you can become a volunteer. And again, I mean, some volunteers come in once a year for one event, and then that's all they need, and it's really great. And then we have people that are there, once a day or once a week, just depending. The biggest thing I like to tell people to do is just read the newsletter, because we're surrounded by people that maybe don't understand what's going on. And so the best thing that we can do is get educated so that we can help teach other people, what's really going on, especially in our communities. I'm going to go ahead and drop our website in the chat. Okay, great. So a lot of the other things that we do is we do a lot of advocacy. And so it's not only like me or the staff doing the advocacy, it's our responsibility to help folks that are directly affected by policies and systems to be able to tell their stories and to advocate for their needs. And so at the end of the day, like if we're not doing that, then, are we really advocating? So um, it might be a little bit easier for me to advocate because I speak the language and I can communicate effectively with folks. But a lot of times when we're advocating things, they don't really affect me. And so we have started leadership programs at CASA where not only, so our first cohort had 8 people, which all happen to be women. Our second cohort does have men. And we worked very closely with them because I'm sure you've heard this before, but I don't feel like we empower people. People already have power, right? So it's our responsibility to provide spaces and opportunities for people to uh, use the power that they have to advocate for their needs. And so it was a year-long uh, training, and of those 8 people, 2 of them we hired. Uh, 2 of them sit on our board, and 2 of them sit on different boards across the city. And then the 2 that are still there are actually helping with the leadership trainings for the next cohort of people to, you know, to learn the skills and be able to, represent their communities more effectively. I sit on a lot of boards, but at the end of the day, I am not an immigrant, right? And so, I was born here. And so it really has to be, if we are a resource center that is really advocating for immigrants, then we really have to make sure that we're representing that. And again, just making sure that for a long time here in Pittsburgh, there wasn't even a seat at the table for folks that look like me. And so getting those seats and making sure the right people are sitting there, I think is really another really important thing that we do. We're looking for people. We're always looking for people to be on our board. We just had our elections. And so we had some folks that kind of termed off this year. Their terms have kind of expired. And so we would definitely love to talk to more people to see if people are interested in joining our board. And again, there's just so many great opportunities to learn more and share with Casa all of the time. I am very grateful for opportunities like this where I can talk about the work that we're doing so that people can learn that that our organization exists in case you know anyone who might need some help, but also to educate folks so that I really feel like immigrants right now are just getting a bad rap from all around. And it doesn't have to be that way. I think that if we can learn to talk to one another about things and really learn um, what's going on, then I think that we can definitely make better changes and like more sustainable changes um, along with the advocacy that we do to kind of change uh, the systems and structures that are in place to hurt people of color. So, um, yeah, that's what I'll say about that. And let me think of, we do so much at Casa where it's just like, sometimes I think that everybody knows what's going on um, and, uh, and it's not quite like that. We were created, we were kind of like birthed out of the Sisters of St. Joseph our founding director is Sister Janice Vanderneck, and she's a sister of St. Joseph, and she started this work, a long time ago, and officially created Casa in 2013. And she always said that, she really wanted Casa to be Latino led. Um, and she worked really, really hard to make that happen. She's a great leader. I've learned so much from her. And she still works at Casa. She's our director of civic engagement. And I'm really, really fortunate to have someone like that who this was her vision. And if nothing else, can we just make her proud? And sometimes the work is really, really hard. And there are times where we're like, oh, maybe I just need a break, or maybe I just need something. And I just look over to her, and she's going and going and going and working so hard that, it just really makes it easy for us to kind of stay focused and keep moving forward. So it's really great to have her there with us. And we currently have two other sisters of St. Joseph that work at Casa, and really just I don't know, it sometimes think really remembering why Casa was started and bringing us back to the mission is what really helps us to continue to do the work, especially in a time that has been so difficult right now during COVID, where our people have been marginalized even worse. We have created several programs, obviously the healthcare program, which is where we do a lot of the outreach and the vaccinations. One of the things that we learned early on is that some folks live within walking distance to a clinic and did not have, a PCP. So there was no like preventative care. And so we have, along with the focus of trying to get people educated and vaccinated if that's what they wish, we have also been doing a lot of work to get people to get preventative care. And one of those things is mental health services. And so, it came to the point where with the mental health services, either I was going to have to ask every single uh, healthcare provider or mental health provider in the city of Pittsburgh and surrounding to hire somebody who was bilingual and bicultural to help folks, or I was going to create a program at Casa, which is another hand-holding experience for folks to be able to access services, and especially things with mental health, because there's such a stigma in our culture and in many countries where folks are coming from where it's not even talked about. And so making sure that we are being considerate of those things and making it seem in a way where it's not so stigmatized, just even to the person that's receiving the help, but and their families if we can. So let's see. There's often barriers between immigrants with disabilities and disability services. Is this something CASA helps or can help with? Absolutely, absolutely. Again, like anyone can, not anyone, but many people can be bilingual. Many people, right? It's just you learn another language, which is kind of hard sometimes. But being bicultural, I think, is what's really important in when we're providing services, especially as direct service providers. And so when we only had one bilingual, bicultural pediatrician in the entire county. One. So just imagine what it's like trying to get services, even for your children, where people are taught different things in their home countries, and then trying to raise children here under like this different type of system, which is heavily like medicalized and like pharmaceuticalized, and it's just very different for folks to grasp that. And then if you think about disabilities, what that looks like there. So it's a totally different realm for most folks. And so really making sure that we're advocating for folks to get the services that they need. And again, a lot of times it's not available in a different language. And, forget about, culturally appropriate services. It's very, very difficult. We're starting a program for kids with autism. And so we've also, there's nowhere to get the services. And so one of the things that we're really going to try to focus on is educating the parents so that they can, advocate for themselves when they're going to the appointments and receiving the services as well. So I'm really excited to start the work that we're going to do. Um, a lot of our case managers will really walk hand in hand, go to appointments, meet with the folks that are working with them or their children to make sure that they're getting the services that they need. We tend to, I mean, so a lot of the services are done by like social workers, right? Which are pretty cool. I'm a little biased because I'm a social worker myself, but and as social workers, we tend to have an understanding, to think that, oh, you know what, actually, you're right. I should be doing this in a certain way. And so we really haven't been met with any kind of resistance. It's just more of like educating folks so that they're like, oh yeah, that does make sense. And maybe we should try to do things a little bit different. Um, Okay, great. Yeah. Again, just really trying to know the people that you're servicing. I say to people that, that organizations that say that they want to partner with us and things, and we're always open to partnering with people because we cannot do things on our own. And we would have never been able to do the work that we're doing right now, especially during COVID, if we didn't have such amazing partners. But I also tell people, like, if you really do care about this population, then you have to start to make decisions even in your own organization where, I mean, translation and interpretation services are expensive. But if you really care about this population, I mean, that's just an expense that you're going to have. You have to put it in your budget. You have to start putting it in your budget when you look for grants. You have to start doing these things because if not, then it's kind of just like, well, I'm just going to say I care about immigrants. And I'm only talking about Spanish, but there's really 9 primary languages that are very commonly spoken in Pittsburgh and in Allegheny County. And I think even in like the public school system, there's over 40 different languages. So again, if you're really committed to serving the people that you say you want to serve, then you got to kind of go above and beyond to make sure that you're providing uh, equitable service to everybody all around. Oh, great, great, great. Yeah, about domestic violence. So we have a very, very good relationship with our women's shelter here locally, and they do have somebody who's bilingual. They have like an attorney that works there that knows about immigration law as well. So it also helps with our families that seek their services. And it is such, a topic that is so sensitive and very difficult for us to cover. And so they've even helped us like put out information so that it's not like so we're not calling it, intimate partner violence or things like that that people might not understand. And so making sure that people know that our services are available. And again, that's also a hand holding service that we provide as well. We work really close with them. Um, it gets a little harder when you are not in the city, right? Just because it's so far away. I remember having to drive 4 hours once to pick someone up, uh, to bring them to the services that we have here because the person was very, very, very isolated, and and it was the only way that we could, you know, help that person, uh, which was to come all the way out here, or like drive into Ohio. Like that probably would have been closer, but then while they were here, at least we knew that they were getting the services. Both in the language that they understood and with people that understood their culture. Um, so the autism organization that we have been speaking to is out in Philadelphia. But if anybody would love to talk more about it, here, I'm also going to put my email address in the chat. I would love to pick up this conversation with anyone that would like to talk more about it because we're definitely learning, but we've just seen such a need for it that we decided that this is something that we wanted to be able to provide to the community. Um, yeah, it's just because it took them 14 months to get us information didn't mean that we really were working very hard to see what other health departments were doing across the country and making sure that we got accurate information and kind of tailoring it to the needs of the folks that we have here in Pittsburgh. The other thing is that a lot of our Latino population is really, really young. So a lot of folks are coming straight from their home countries. And so, you know, again, it it really does make a difference when you're putting out information to make sure that it's tailored to the audience that you have. So, um, just make, and then, but again, like I said, when their information came out, it was really all about COVID and nothing about the vaccine. And so now we're really trying to do what we can. We're going to conduct a door knocking campaign um, in different areas where we know that we have people in our community living. And we're going to do, it's going to be twofold. It's going to be, um, like voter registration and COVID registration. We have a healthcare facility who's going to partner with us on that day, who is going to be, so it's like, um, I don't know, maybe like a 15 to 20 block radius where we're going to go door knock. And so the plan is either to have a mobile clinic for them set up there that day so people can get the vaccine that day, or helping them schedule appointments so that they can go to the clinic on another day. But the clinic is also really, really close. But I thought that having the mobile clinic there might help better to get people to get their vaccines, right then and there. And what else? I only have 3 minutes. I didn't think I was going to be able to fill the time, and I only have 3 minutes. So I don't know if anybody had any other questions about the work that we're doing. But again, I would love to have people, visit our website. There's a lot of information there, and you can see the past newsletters on there as well, and then continue to get the newsletter moving forward. And again, I have my email there. If you ever have any questions, please feel free to reach out to us. We really are here. We're always looking for partners. Um, so that again, we don't we don't want to say that we specialize in any one thing. And because we have so many partners to be able to refer people to, like that is what helps us grow more and more. And so we're super excited to learn about different organizations that are providing services and and be able to work alongside them. Okay. So any more questions? I don't know. Now's the time. Yeah, language, I think it's just so important, especially for places that are federally funded where it's legally they're supposed to provide these services. And again, I understand that it is expensive. I do understand that. But again, like even Casa, we're a very small organization, and we have a lot of folks that are coming from like Guatemala, where they speak like a, a Mayan language, a Mayan dialect, and that's their primary language. And I don't speak that language, and neither do any of our staff. And so when we have folks that come in and need help and they don't speak Spanish, we have to do what we can, which includes, hiring interpreters to help us provide the services that, for those folks as well. We have folks on staff that speak Spanish and English and Portuguese, French, and in Arabic. And so, we try to make sure that we're doing what we can. Um, and then we're also part of a network called the Isaac Network, which is Immigrant Services and Connections. And they will have other offices as well throughout the city. And they do speak different languages because a lot of them work with uh, refugee families. And so they have, we could pretty much help people with well, I don't want to say any language, but the most popular languages that we have in Pittsburgh. It's just that right now, the languages that I was referring to from Guatemala, they're not the most popular ones yet, because I'm sure they'll get there. And so that's why we have to use the like language line and things like that uh, to get them services.
Thank you, Monica. So again, if any, the email address for Monica is monica@casasanjose.org. If there are no other questions, we're going to take a break, and our next session will start at 1:30. Thank you. Bye.